DOLA Patient Ready Orthotics. The orthotics podiatrists use. A collection of our 9 most popular and proven prescriptions developed from over 50 years of clinical and orthotic experience. Patient-specific styles, ready to fit in clinic, orthotics for health professionals only. Case Study Test Fit Series. Patient Presentation. Our patient is a 45-year-old male with symptomatic medial tibial stress syndrome and tibialis posterior tendinopathy during daily activities, walks, and social sport. He has no significant medical history or underlying disease condition and wants to maintain activity for general health. He has a family history of type 2 diabetes, so wants to maintain a healthy weight and manage blood glucose levels. He is moderately pronated in stance, with an everted rear foot, lowered medial longitudinal arch, toes visible laterally, a talar navicular bulge, and the talar head palpable more medially. His pathomechanics is an increase in tissue demands on the tibialis posterior beyond the current tissue capacity, from a combination of frontal and sagittal plane function. During gait, the rear foot everts through midstance and does not resupinate into propulsion, with an abductory twist of the rear foot seen at heel raise. The forefoot shows signs of instability and splaying, especially on propulsion. He also has a mild ankle equinus, or reduced ankle range of motion, both in non-weight bearing and functional assessment, and mild functional hallux limitus signs, with high force required for activation during JAX test. We plan to include a patient-ready orthotic in his treatment plan from the 9 options available. Confidence it will help. This patient responded positively to treatment-directed testing of antipronatory low-dose strapping, a medial rear foot wedge placed in his work and sports shoes, load management with activity modification, a rehabilitation program to improve the functional capacity of the tibialis posterior, and in-clinic treatment protocols. The patient also has an appropriate selection of footwear for his weekly activities, and they are orthotic friendly with removable insoles. Why it will help. Based on the key points of the patient assessment and treatment-directed testing, we selected the Pronation Patient Ready Orthotic. This style is designed to provide medial support at the rear foot and midfoot that the pronated or flat foot needs. Key features of the Pronation Patient Ready Orthotic for this patient include the medial rear foot wedge, the medial arch support, and the mild heel raise. Need help finding the right orthotic for your patient? Use our online orthotic selector tool. Tell us about your patient, their activity level, pathology or lifestyle and performance goals, their foot type, clinical test results, and we will recommend the best patient-ready orthotic from our range. The Pronation Patient Ready Orthotic was fitted to the patient's footwear following the fitting guide, including to his Mizuno Wave Prophecy 3 for daily walks and social sport, and his Echo Vitris boot for work. Patient-ready orthotics come in 11 size options, from a kid's 5 to a men's 15+. Keeping a size range in stock in clinic allows you to test fit and select the correct size for your patient's footwear. Don't have the style you want in stock? No problem. Just test fit another style to choose the size and order the style and size required direct from us with our in-stock guarantee. It will be sent from our Australian factory direct to your clinic, giving you the confidence it will fit the patient's footwear. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit dolarorthotics.com.